So thank you everybody for joining us. The panelists that we have with us today are Bonnie Hurst, who is from Methodist Health Systems. She's in performance analytics, and so I know some of you will be really interested in knowing what that is all about. Amanda Ballard is with us. She's with DentsplySirona. It's medical and dental device company, and her role is as an educational programs and content manager. We also have Jolie Bishop, and Jolie is a recruiting specialist with Life Schools, and there are 10 Life Schools campuses in the Dallas area that you may have heard about. And then we also have Samuel Goyal, who is Associate Executive Director with American College of Emergency Physicians. So right there, we have a good number of different industries represented, and I'm excited to hear from our panelists. So I'm going to turn my video off, so all you are going to be seeing will be our panelists. And if y'all would introduce yourselves. I've already sent you some questions so you know some of the topics that we're interested in. So I'd like to hear from each of you what your background is, how you're connected with UTD. If you're an alumni, that would be wonderful. Tell us about your career path, a little bit about you, and then we'll go to some questions. I have plenty of questions to ask you. So I'm going to go away for a moment and just turn it over to all of you.
Should we go in the order you introduced us?
That'd be fine.
Okay, I'll get started. Hi, everybody. My name is Bonnie Hurst. I am a senior project leader in performance analytics for the Methodist healthcare system. I work for their corporate system. My connection with UTD is I got my undergraduate degree there in neuroscience, and I graduated back in 2016, and then I went back to get an MBA and a master's in healthcare administration there as well. And I graduated from that program, not this May, but the one before that. And I've been working with Methodist for about 7 months now. And generally what we do in performance analytics is we do quite a bit of reporting for the system as well as for the individual hospitals. We use data from our analytics partner called Premier and from our EHR Epic to find opportunities for improvement for patient care and patient safety. And we do a lot of improvement projects throughout the system as well. One of the things we're focusing on right now, for example, is trying to reduce sepsis mortality across all patient cohorts in our system. And we use data to help analyze where those opportunities for improvement are.
Thank you, Bonnie.
Okay, I think that means I'm up, right?
Right.
Okay. Hey, everybody. My name is Amanda Ballard. Like Janie mentioned, I work for DentsplySirona. What I do is I run a global education program that supports doctors and dentists and orthodontic specialists. So we're technically we started as a small private startup. And in 2018, we were actually acquired by big corporate. So we've gone through the transition from small and agile to big and publicly traded, which has definitely changed a lot of the things that we do and how we approach stuff. But for my team, because we were part of really a technology company, it's a digital treatment planning system based on CAD/CAM. Some of you have probably heard of things like Invisalign, I imagine. We produce the technology that's behind systems that are kind of similar to what Invisalign does. They would be one of our competitors, actually, on the aligner market, so those clear plastic trays. I don't think I have any on my table here to show you, but we do much more than that. So it involves teaching doctors and specialists how to translate their knowledge and expertise from physical chair side and working with plaster models into the digital domain, so that they can think in that kind of space, that 3D CAD/CAM space, and design treatment plans from start to finish. For some cases, that means it could be 13 years. If you're working on a child's case, they may have multiple phases and stages. If you're working on adults, maybe it's only 12 months. But we work with braces, we work with clear aligners, and surgical and everything. So what my team's job is to educate doctors. So we have technical experts, we have instructional designers, and we also built an entire learning ecosystem that adapts to each different learner profile. And so we have to work with different types of AI on the backside that are supposed to be predictive in that learning environment in order to help them, our different customer bases, different markets around the world, that are tailoring that learning experience to be more just in time. So less punitive, not something that you do for compliance, but more like Google and YouTube. You have a problem, you want to solve it now. We want to be able to push that content up to the top of their learning profiles and experience. So it feels like we're predicting what they're looking for. And my team's job is to design, development, and oversee all of that content, and then also the execution and delivery of the learning programs themselves. Briefly, connection to UTD. I have a master's in literature and also a master's in applied cognition and neuroscience from the BBS, both of which were focused on memory and language.
Thanks, Amanda. Jolie, you're up next.
All right. Hi, my name is Jolie Bishop. I work with Life Schools. My title is recruiting specialist, and that's actually my connection to UTD. Is I have come to career fairs there for students interested in education. I know sometimes even if you don't major in education, you have a degree that's very applicable to being a teacher that would help mold and shape students who are preparing for their futures as well. So it's a very versatile career to choose to be a teacher. I taught for 10 years before I became the recruiting specialist. And so Life School is a public charter school. We're celebrating over 20 years of serving our students and communities across the Dallas area at 10 different campuses. And so our mission is to develop leaders with life skills through strong academics, character training, and partnerships with parents in the community. We've kept our same mission over the 20 years, and really the heart of our school is to serve Title I students and their families and just provide the best education possible.
Thank you. Samuel, you are up next.
My name is Pawan Goyal. Good morning, everyone. I'm a surgeon by training, ear and nose and throat specialist. I work for American College of Emergency Physician as Associate Executive Director for past 4 years. Prior to that, I worked for Hewlett Packard HP as their Chief Medical Officer and Chief Medical Informatics Officer for 16 years. My relationship with UTD has been in a couple of areas. One is I've been a visiting guest faculty to healthcare management program to UTD and often lectured there. Also worked as a guide and mentor for various PhD programs with computer science department at UTD for any research that involved healthcare topics. So that has been my involvement. A little bit about ACEP. So American College of Emergency Physician is a non-profit membership-based professional society. It is headquartered in Irving near airport. We serve 40,000 plus emergency physicians across the nation as our members. As a 52-year-old organization, ACEP has been working with all the medical colleges in the nation to build the course curriculum, training programs, exams, certification, etc. for emergency physicians. We also build clinical policies, workflows, protocols, best practice guidelines, etc. that are used for all 5,000 hospitals in the nation. In fact, most of the hospitals across the world. For example, for COVID-19, we put together a guidebook for how to manage COVID in emergency department. That guide was produced within few days once COVID hit, and it is currently being used by 150,000 physicians across the globe in 70 countries as a principal method of treating COVID. And that guide is being updated on a weekly basis as we are learning more and more with COVID. I have responsibility of managing a line of service at ACEP, which is called Quality. Quality is an umbrella organization which consists of 12 departments. Those departments include health information technology, health informatics, patient safety, quality collaboration. We have quality improvement programs. We manage supply chain, especially focused on COVID and availability of PPE across the nation. We do a lot of physician education around quality and patient safety. and several other areas. Our biggest focus right now is a registry around emergency medicine, where we are collecting data from more than 1,000 hospitals across the nation to understand the variability into care, to improve the patient experience, cost of care in emergency department, and improve the wait time in emergency department with those three key focus areas. We have been working with UTD for last 3 years with our internship program. We get a lot of great interns from UTD, and most of those interns, once they have completed our internship, get very good jobs in healthcare industry, and they are very well placed.
Thank you. That was very comprehensive. I think sometimes we don't realize how much. I don't think we've realized how much of an impact COVID-19 has had on everybody. And to come face to face with you, Pawan, having dealt with this at the emergency room level and all the planning and the logistics of all of that and everything you're learning every day, your job must recently, the last few months, have been extremely challenging. So thank you for being here today and taking the time to talk to us. I have a couple of questions for all of you, and take turns as you do this. But my first question would be, in terms of your current position, how did your undergraduate and graduate level education, how did that prepare you for the work that you're doing now? How has your career progressed from the time that you graduated first from college?
I guess I'll go first again, just keep the same order. So as I stated before, my undergraduate degree was in neuroscience, and I've always had a passion for biological sciences and healthcare itself. So for a while, I was unsure as to whether I was going to go into research or attempt to go to medical school, or what direction my life would take. And after I continued to explore the opportunities of just general biological sciences and that realm, I found that I actually really enjoyed working in a healthcare organization, but not necessarily in a medical capacity. And that's where I discovered the field of healthcare administration. And that's also how I discovered the field that I work in right now, which is also quality. So I help oversee and ensure that quality standards are being met through the data that we collect, helping set targets and things like that. My graduate degree, my MBA and my master's in healthcare administration.
Oh, Bonnie, I think we lost you.
I think we lost Bonnie.
I think so too.
When she comes back, we'll ask her if she can take up where she left off. But Amanda, do you want to start talk with us a little bit about your educational background and how your career progressed,
Sure.
how it prepared you for your career?
Sure. So I actually spent 7 years as an English professor and ran the English program my last year at Eastfield College. So I taught at Eastfield College, several different schools as an adjunct full-time at Eastfield in the Dallas County Community College District, and then ended up also teaching actually over at UT Dallas in the transition between the humanities and the sciences. I was taking classes in the humanities, for that graduate program that led me somehow into language philosophy and then anthropology, trying to understand how language works, where it comes from, what language represents as far as like knowledge and understanding, identity, meaning. And ended up kind of in this limbo space between the humanities and the sciences, and realized that language philosophy couldn't answer all my questions. I needed to get below the language of philosophy and into something that's a little more concrete. And so while I was teaching English, I started the neuroscience program to study language and memory and cognition. How do we process language? How do we understand the way that language inframes the way we see the world, the way we understand, and the way we engage with meaning, or construct meaning anyway. And as I started taking those classes, I started changing all of my English classes, one, out of MLA, and two, into APA, but also changing the way that we attached or understood and approached language and the construction of an argument in a more inductive way, looking more at experimental design and understanding even things like how do we construct questions in a research study, because the way that you use language can, of course, bias the outcome and the results of what your responses are going to give you. So the sciences completely changed my relationship to the humanities, how I taught language at all, and how I helped other people to learn to wield language and the way that it worked. In the process of that, for UT Dallas, what I ended up doing is creating a program, working with their faculty, their full-time faculty, for writing across the curriculum. So I tailored my class then to students, undergrads, who were learning how to write for the sciences, because it's very different than writing an argument or writing a personal bio. And that understanding of how we can use language to craft a narrative and also to either bias or unbias the way we represent knowledge and information, was really important in my transition out of the humanities into the sciences and then out of the academic world into the corporate world. So for me, that neuroscience degree was a big game changer. I had to learn experimental design. I had to learn to create these very concrete contextual methods of expressing and explaining information. And in the business world, it's all about data. You know, you can express all of these thoughts and ideas, and even in marketing, it all comes back to data. So regardless of like the beauty of the aesthetic and the storytelling, if you can't quantify it, business leaders don't understand expression or feeling or even beauty. How do you quantify that? But they do understand bottom line. And so for me, that neuroscience degree gave me something tangible and concrete that I could take the creative and artistic side of my humanities self and then translate that into the business world. And those studies are what ended up getting me that job that moved me into the corporate sphere, because I could conduct research and then I could translate that. And so that's kind of what I do now. I deal with like the behavioral side of learning, and then I try to craft learning experience by predicting what's going to happen, creating a system that will tailor it so it seems invisible, which if you look at the things that like Amazon does, Google does, they're doing the same kind of thing. And it's that analytic behavioral understanding the quantifiable, the predictive analytics, really understanding statistics, and then being able to frame that in a way that business leaders can turn into profit.
That's an amazing and wonderful explanation of how neuroscience and language and literature and communication all fit together. Thank you, Amanda. That was wonderful. Go on. Pawan, if you would talk with us a little bit about your educational background and how it prepared you for what you're doing now, that would be nice. Thank you.
Sure. So my undergraduate degree is in medicine and my postgraduate degree was in surgery. And I did both from India and then started practicing as an ENT surgeon in a teaching hospital, which was multi-specialty hospital. And I struggled in the beginning, when I started to practice, to see that we were trained as physicians to be good diagnosticians, to understand the patient problem and treat the patient well. We did really excellent when it came to individual patient care. But we struggled to have a dialogue with the administrators who were trying to maximize resources, and we were trying to help our patient to best of our abilities. So it was a challenging dialogue to go and ask for new microscopes and new
I have
equipment
to
and better
listen. Your
anticipation.
internet connection is real little.
That led me to believe, that I needed more education. So I joined the part-time evenings business school to do an MBA in hospital management over a 3-year period while I was still practicing. That really provided me a lingo and the understanding of what was the business side of healthcare. It prepared me well to understand the budgeting and the policy and the human side of healthcare, and I started to apply those principles. After I had degree, I started to work on various task force for quality improvement, practiced those for almost 10 years, went to 5 countries in Europe and learned about their healthcare system and came back and applied that knowledge in India. My quest for knowledge brought me to US as a student. So I came to US 23 years ago to learn how was US healthcare system, what could we learn from it. I joined Ohio University and to their Masters in Healthcare Administration program. And during that program, I also taught at the medical school on how to do medical research. And HIPAA was very new at that time. So once I completed my MHA, I joined a second master's program into health policy, ethics, and economics because nothing happens without policy in healthcare. That was one area where I needed more learning. So after completing another master's in health policy, ethics, and economics, I started to work for HP and started to support federal government with various policy and solution aspect where we work with various government entities to work on Medicare Part D implementation, Obamacare implementation, and various other national level projects. While I was doing that, I believed that I needed more learning. So 10 years later, I joined George Washington University to do another master's program into policy analysis as well as process improvement. After completing that, I have been engaged in various industry organizations to pursue the lifelong learning goal. I have ended up with 4 fellowships with various organizations. One of them is with the US National Library of Medicine into informatics and data management. The second is with an organization called HIMSS, Health Information and Management System Society, to learn about the use of information technology in healthcare. The third one is with an organization called AHIMA, American Health Information Management Association, which is focused on medical records and documentation of care practice and behavior. And fourth one that I just completed last month is with AMIA, American Medical Informatics Association, which is use of all the data analytics, computer science, machine learning, etc. into healthcare, and how do we get to learn about healthcare variability and improve the practice behavior. So I firmly believe that learning is a lifelong opportunity and a process. It never stops, especially in healthcare where things evolve and change very rapidly.
That is an amazing background and story. And the theme I hear from both you and Amanda sounds like you just don't stop. Whatever your bachelor's degree or master's degree is in doesn't necessarily mean that's exactly what you will be working in the rest of your life. You take advantage of new opportunities and gosh, how many master's degrees? 4? And yes, 5. It's just amazing to hear stories like yours, both of yours, and see how varied your experiences are going to be. Once you leave college, you're not going to stop in one place. And to me, that's really encouraging. I'd like to hear from both of you what your advice would be about technical skills that our students need to be working on now and developing before they graduate even, so that they will be marketable once they finish their degrees. What technical skills do you think they need to focus on?
Oh man, I'd say get as much as you can out of those stats classes. That is a big deal. Whether you're looking at predictive analytics, whether you're just looking to translate a large amount of data in a matrix into something that's communicable to a CEO, to communicate to the C-suite. you're going to have to be really good at representing information that captures the meaning of that information in a way that someone who thinks in terms of margin and bottom line is going to understand it. So really understanding like experimental design translates really well into understanding how to work on a project, how to design a project, how to execute a project. And then the statistical methods that you take those classes, like really get as much as you can out of that. It's a great opportunity to learn as much as you can from those faculty members, but also from your peers, from the grad students. Stats is, it's not just behavioral science, like it's the language of economics. It's the language of so much of the world that we're in that, I see so many people in the business world who don't really know what data means. They don't know what a real value is in terms of large data sets. So for me, I gained a lot from my humanities side on how to communicate and what to communicate. But that data side is the language of business. So, that can translate very easily into healthcare, but it can also translate into sales and marketing and everything else. So overall, if I were to say like really buckle down on something, your stats class and your experimental design classes, that's going to set you up for success in a lot of areas.
Thanks, Amanda. Pawan, how about you?
So I have to agree with Amanda, she said it so well. I would like to divide this question into two parts, So I believe that 20% of the success comes from technical skills, but 80% of the success comes from soft skill. So they are equally important. So let me walk through kind of a use case for success. So building upon Amanda's example, data is probably the oil of 21st century, nothing happens without data. So very fundamental knowledge of computer science, data science, statistics is extremely important. The biggest piece is to take it through a 5-point maturity model. So data is the real fact that we collect. Once we process them, we convert them into the second stage, which is the information. Information is taking usefulness out of data and make it presentable. When we present it, it becomes knowledge. So it is about third level of maturity, which is around sharing of knowledge. And why do we share knowledge? We share knowledge either to harness a business opportunity or to solve a business problem. That leads to the fourth level, which is around bringing the change into the practice behavior. And then fifth level is to make it institutionalized. So take that practice behavior and start transforming the culture of the organization and people in that organization. And that requires a mix of understanding, what is the organization? What is the community? Who are our stakeholders? What are their aspirations, business needs? What makes them successful? What makes it challenging to implement a change? And that requires a good mix of soft skills in terms of communication, in terms of team behavior, in terms of respecting the diversity and difference of opinion, and be able to focus on what side of the mission and not so much argue about the how side of. There could be 1,000 ways of doing things technically, and all of them could be right, but then which one will be easy for end stakeholder to adopt to, and which is cost effective. So that's the kind of skill we should be preparing for it. And a piece of advice, how do you acquire those kind of skills? Go out, go out into the community and work for an organization. Look for internships. If you don't get internships, do volunteership. Find ways to get into a practical project or into a real organization. They will teach you how to present yourselves into a group dynamics and how to understand and take the fundamental knowledge that our universities provide us, which is extremely valuable, but how do you apply it to the practical projects for problem solving?
I think that's a really good point on all of those fronts, but really turning it into something that you can apply, because there's the theoretical side and then there's the practical application of knowledge. And, we spend a lot of time in school learning, but to translate that into something that's functional and useful in a specific context matters a lot. And I know for me, I love to be able to bring interns into my team because they usually have a lot of energy and a lot of ideas. They're very willing to learn and adapt and try new things. So they bring a lot of energy and innovation. But they come in and what they do is they learn from the practical experience of the workforce that's full time in the business, and it's a great collaboration. And I know for me, when I was making big career transitions, what I did is I started with the network, and I joined several professional organizations and became a volunteer to say, I want to learn from a lot of different industries. So not picking one, you've got 5 master's degrees, totally. Learn from what's out there, try new things, grow that skill set, build a portfolio of concrete examples where you apply the things you've learned in a way that matters. Because if your stakeholders can't understand it and they don't need it, it might be great, but it doesn't solve the problem. I think those are really great tips.
Thank you, Amanda, and Pawan also. Both of you brought up some really great points. I want to ask one more question at this point, and then I'm going to turn to Alan and see if our students have questions, and then I'll have a couple of more questions to end with. I really appreciate the information that you're providing for our students. The question I have right now is, as students are preparing for internships and possibly full-time work after graduation, can you speak to the value of, or compare the values of working for a larger established company or working for a startup, and how those experiences might be of help to students as they build their careers?
Oh man, they're very different and both really valuable in their own unique ways. I started in the business world once I left academia in a little startup, a little technology startup. So very agile, things move very fast. Our R&D timeline was less than 12 months. We were, software changes at the speed of light. And so a small company is a great place to really learn and to try on many hats. The small private companies, they have people who do many different things. It's not just, you're not just doing one thing. You have a chance to try many things. If you want to say, I want to help on this marketing project. I want to spend some time working with the engineers. I want to understand how R&D works. You can get into different projects. You can try on different roles. And a lot of times at those small companies, because you have fewer people, but you need to be able to move at a much faster pace. And oftentimes it's so much more personal touch with your customer base that it's a great learning environment. And a lot of times smaller companies are also going to be more willing to say, we're going to hire for talent and grow you because they have to be innovative. They have to be agile. And by contrast, the big companies, right? I'm part of a big corporate publicly traded company now, which means in the medical device industry, lots of regulations. Everybody on this call, they know MHAs, medical fields, all these different things. So heavily regulated. And so that big corporate body, it moves much slower, but it's far more stable. It's got so much more spread. But what you see in the big companies is they tend to specialize. And so if you look at big corporate bodies, a lot of times like their job boards, they're hiring, they're looking for a very niche specific talent. So if you work in machine learning, there's lots of different areas that you could go into, but they're going to want you to stay in your lane. So it's going to be a more narrow space. The smaller startup companies and small private companies, they tend to allow you to do more code switching, so you can try on more hats. But they're also far more susceptible to the whims of the marketplace. So there's some good things on either side. I think for young people who are just entering the marketplace, get those internships, but try on different things to know where you want to go. you may not end up going into the field. I mean, I studied poetry. That's where I started with my undergraduate, was Shakespeare. You may not end up in the exact place that you think you're going to go, but if you take the knowledge and skill sets and realize like what they are at their core, you can code switch. But to know where you feel your strength and where you really accelerate in the business world, you have to try on those different hats. So the internships are great. A lot of times small startup companies, they will go out there and they'll find those interns. And then if you make yourself instrumental to their operations, they may just turn around and hire you right there. And if not, what they do is they help you build your network. Right. So I think it's great either way. And Dallas has a ton of tech companies, which are really great for kind of stretching your legs and growing your network.
Thanks, Amanda. Pawan, we were talking about for students thinking about their first jobs out of college as they prepare for those careers. What are the differences and what would be your advice in comparing startup companies with more stable or larger companies or corporations?
So I think Amanda covered it really so well. So having worked 16 years with HP, which was a Fortune 5 company, world's largest IT services company, 16 years, and then now 4 years with American College of Emergency Physician, which is a relatively small organization with 170 employees, versus HP, which had 370,000 employees across the world. So there is certainly differences and similarities in internship in large versus small companies. The large companies have more structured way and they have timelines that you can apply only once a year. Internship is only for 2 months or 3 months, and you are assigned to a particular project. Then you are currently working on one area and getting expertise in that area. You may kind of become a specialist or a super specialist and build a niche into that one segment, but that's the only thing you learn. And there is often decision making is slow in large companies and flexibility is less. However, the smaller companies are pretty nimble. There is more agility. You can wear multiple hats. You can learn a lot of things. You may join one area to learn X. If you don't enjoy it, if you feel, oh, this is not the right place for me, you may have opportunity and flexibility to switch and go to other department or other area of practice and learn much more. And in terms of soft skill, I think you have better opportunity to build relationships and trust and gain more of soft skill into smaller organization than larger organization, which tend to be very formal.
Okay, thank you. I appreciate your response on both of you on that. I've heard from Bonnie and from Jolie. They're both having serious technical problems. So I'm hoping that you two just don't move, don't wiggle. Stay with us, please. Alan, do we have any questions from students at this point?
Yes, hi, Janie. So there are a couple questions that came in. The first one is for Pawan, and this is a big question. So the question is, you've studied healthcare throughout multiple parts of the world. As a result, what aspects would you change about healthcare in the United States?
That's an excellent question. I think one difference I saw in United States and that kind of shocked me was a three-party system. So we have 3 P's in healthcare here. One is the patient, certainly that is should be the center of the universe. Second is the provider. That includes the hospitals, clinics, physicians who take care of the patient when they need help. The third is the payer, somebody who is paying for those care. And the dichotomy is that patient has a problem. They go to a physician or a clinic or a hospital to get treatment. Physician will treat them irrespective of patient's ability to pay or not pay. But when it comes to payment, so third party is now paying you, which is your insurance company. And they are trying to kind of squeeze both the patient as well as the hospital. They tend to deny a lot of claims. They tend to ask for discounts on various kind of claims. And there is no understanding what will get approved until service has been rendered. That has been one root cause of problem in United Healthcare system that need to change. patient need to have more visibility. So take example of a car buying experience. If I have to buy a new car today, I have opportunity to go to web, look into various websites, whether it's Kelly Blue Book or whether Denada, and look into various kind of car models, upgrade features, safety rating, pricing. You can build even a pricing around that. You can even negotiate what is a dealer price versus sticker price versus this price and that price. You can go prepared with that analytics to a car dealership with all your homework done. But if you are a patient who has a knee pain or a hip pain, if your physician tells you you need a hip replacement surgery, do you have opportunity to get information? Where do I go? Which is a safe place? Which place has a better quality of hip replacement? What will be the cost of care? How many days will it take for me to recover? That kind of information does not exist. So that's the second thing, which is the information transparency from consumer perspective. So we have to create a consumerization of healthcare into America. The third piece is skin in the game. So patient currently has co-pays and deductibles that we are responsible for our out-of-pocket cost, but we don't have enough control and understanding. So we should have those dialogue upfront with our treating team to understand, okay, I'm going to have this hip replacement surgery. What is my component of the cost? First, what is the true cost to the system? Whether it will cost 5,000, 10,000, 15,000. What if infection happens? What if a complication happens during the surgery? Will that cost escalate to 15,000 to 50,000? What will happen? What will be my component? And so that I go prepared. A lot of people don't have enough bank balance to manage those kind of complication and surprise billing. So we have to improve that. And the last piece is we expect government to contribute a lot to the healthcare. Every time it comes to healthcare, we expect why government doesn't care. Why doesn't government cover like our COVID treatment cost for even for testing for COVID? At the same time, when we are expecting government to cover something, what is our role and responsibility in that scenario? 30% of US population is obese, but do we take care of ourselves? Do we go to exercise program? Are we taking care of our own nutritional health or not? When we get sick because of our obesity, we expect somebody else to take care of us free of cost, and we do not want to resort on our own responsibility. So it's the behavior change that need to happen at consumer level.
Okay, thank you. Thank you for that answer. So here's another question in the chat. It says, with a constant stream of new information, how do you distinguish what is quality information? And how do you build upon into a new skill set?
It's a bit of a nebulous question when it comes to information there. And of course, the digital domain has provided us access to the entire wealth of human knowledge at our fingertips. And some of it is credible and some of it is not. So that's definitely a challenge. How do you know what is reliable? How do you know what is credible, especially when a lot of the information out there, you've got some information channels and organizations who also make a specific effort to imitate those credible sources out there. So that further obscures how do you make a good selection? How do you know? But then the question is, what kind of information are you specifically looking for? Are you looking for information in the career sector? Are you looking for information in research? It's going to be different by your specific information target. If you're trying to find reliable news, that's a very different calibration process than if you're looking for reliable research in your specific field. And the source of that credibility, whether you're looking at open source research, if you're looking through, research methods that are in your library that have been curated for you by library experts who understand that marketplace for information and information resources. So I think it really depends kind of on what the goal is, what kind of information you're looking for. But relying on credible experts, of course, that's something that we want to be able to go to. And we have to be able to question, like critically question what we're receiving in that information. Just because we're getting information doesn't mean we should take it at face value. For me, that comes back to some of those research courses, research methods courses, your statistics courses. Like if something feels funny or if it smells funny, maybe it is. It doesn't hurt to question it. It certainly doesn't hurt to say, what are the sources for this information that's being presented to me, and try to get down to the bottom of it. But, for the business side of the house, like find a mentor. Find somebody who can give you knowledge and experience, but don't take that one person and their advice as the sole answer. Ask many different people because, like Pawan said earlier, there may be many different paths to the same end goal. So solicit information from multiple sources, compare, and think critically, like really challenge the information that's being provided to you to make sure that, maybe it is a little bit biased by any presenter. Whoever writes a news article, it's going to be biased by their own position, their leaning, their leadership, what they will publish. So, really you have to approach all of those different aspects with a critical mind, and really go after reliable sources. And that means looking for the experts, looking for publications that reliably provide source content to you, like check your references. Check your references. Same thing. When you write your own papers, make sure you're using credible references. Just apply that same kind of critical mindset to whatever information you're going after and find the people who are reliable and credible enough to stand on.
Great. Thank you, Amanda. Another question is, what do you think about the idea that the career you start in your 20s needs to be the career for the entirety of your life?
Oh, no. I feel like 5 master's degrees later, Pawan has given us some pretty good examples of the fact that that's not necessarily true. And if you look at data and statistics about what's going on out there in the world, especially with like the millennial and the zennial generations, they're job hopping quite a bit. Every 2 to 3 years, you might see in your first 5, 6, 7, 8, 9, 10 years, you may job hop quite a bit to try different things on. Maybe you like the marketing role that you're in, and you're doing all this like data mining and analytics to figure out how to drive behavior, but maybe you don't want to be in the small business sector. So you want to go try and work for Adobe. Maybe you want to go try and work for Microsoft. But the career you start with doesn't have to be where you end. Experience is probably the best designer, and what you need to come back to, which means you have to try stuff in order to know what you really want. You don't know what you want when you start. And you, like every cell in your body, is different 7 years from now. So you physically are a different person. The way you perceive the world, you will be a different person. Experience changes you over time, and the world changes. I mean, where we were in January is not where we are now. So with all those different variables in place, I mean, you have to really just kind of take stock of where you want to be, and it's okay to change. You don't have to say, well, I made this decision when I was 24, and so a 44-year-old me must be accountable to 24-year-old me and my decisions. I think that we change quite a bit, and it makes sense that we would adapt to new evidence and adapt to a new environment. So where you start doesn't have to be where you end. But if you do want to get into a really technical area, like sometimes it can help to just say, like, I'm going to go deep. Like you want to be a professor, you want to be a professor at a top tier school, like you're going to have to go pretty deep. But that doesn't mean that you can't shop around and also collaborate. Multidisciplinary work is great to expand your own repertoire, but don't hold future self accountable to present self, because this will be past self at that point. So adapt as you need to, because the marketplace is going to change, and so should you.
Yeah, and if I could add, the speed of change is also becoming very rapid, and I may seem dated, when I went to med school and started my career, we had no computers. They used to be typewriters. There were no cell phones, what to talk about smartphone. There was no internet, no Wi-Fi, no email. Companies like Google, Amazon, Facebook, Apple did not exist at all, And now those are the choices for a lot of our students, So technology has evolved. We, as physicians, we used to document on paper chart, No more, we have electronic health record now. So the practice behavior and use of the technology and tool has brought a lot of transformation in the industry. So change is the only constant, I'll say, and we have to be adaptable to the change. Unless we can change ourselves with the changing marketplace and the technology, our skill set will be redundant very soon.
Okay, thank you both for that. So here's another question. How do you get your foot in the door, so to speak, to get that first internship or position? When you haven't had a lot of experience yet, how do you convince companies, recruiters, etc., that you are worth bringing into their team and investing in them?
Well, for students of UT Dallas, like you're already in a good position. Your networks matter. You've got faculty members all across that campus who are knowledgeable, who have networks. I mean, UTD was founded in the was it 80s or 90s as kind of a think tank, as a graduate school by some tech people who also wanted to say, let's connect the humanities and the sciences together, because like, wow, what could we do with that? There's an enormous network at UTD that's connected to, I mean, some of our hard science labs are connected to the government through different types of grant-funded research. There's so much available. There's also a career counselor group at UTD that's really good at helping to identify those opportunities. But there's also professional groups out there. And quite a few of them across the Dallas Metroplex, oftentimes that have like national organizations that they're part of. So you can join a professional organization. Oftentimes those are nonprofits. And as a student, you get usually a pretty significantly discounted membership. I'm thinking for the group that I joined when I was still a graduate student, the first time around, I joined a group called the Association for Talent Development in Dallas. And that was a massive network of people who do teaching and training and coaching and instructional design and leadership development and organizational design and development. And what I wanted to know is, what do people even do out there in that industry? If you're at that point where you're like, I don't even know what I don't know, and that's a lot of us. Anytime you try something new, that's going to be the case. Joining those nonprofit organizations, being a volunteer for them, and just saying, I'm going to learn, so I'm going to give in order to get, rather than I'm going to show up and wait for what you can give me. It's a really great way to just get started and say, I'm going to go and spend some time in this professional organization or working with the career counselors at UTD, or even, asking for mentorship from some of your faculty if academia is the direction you want to go, to say, I need help and I need to learn, and I'm willing to put time and energy and effort into that discovery process. Because when you offer something, people are far more likely to give you something back in return and accept that offer. So I'd say leverage the resources you have on the campus, leverage your faculty as talent, leverage those grad students who may be also doing internships for different groups and areas, read broadly, and join one of those nonprofit groups and just meet the people who work for Southwest Airlines, meet the people who work for Amazon. Find some groups that you want to belong to and you want to learn from and you want to connect with. And oftentimes they'll connect you up to different levels of leadership across those different organizations. So you can just kind of stick your toe in the water and say, is this something I want or not? And if it's a nonprofit, do a different nonprofit each year. I mean, just try it out. And I guarantee there's a lot of people around you who are willing to help if you just ask and take that initiative.
So
thank you. And I've got actually a couple more if we have the time. the first one is a student reached out and said, are we able to contact the panelists? And if so, how would we go about that? And then I'll jump into the second question. What are you looking for in an intern in terms of experience and soft skills?
So let me start there. First, yes, certainly you can contact us. I'm sure UTD can share our contact information with you. I can give mine right now. It's pgoyal@acep.org. That's my email address, and happy to guide and help any way you can. In terms of what are we looking into interns, in fact, we are looking for nothing. We are looking for the right mindset. It is kind of a collaboration. I'm always looking to learn from our next generation of leaders. They are innovative. They are risk takers. They are not afraid of failing. They bring new thinking. I'm bringing them in to learn actually from them. At the same time, we are trying to expose them to office environment and help them use the knowledge they have gained in the university to apply into practical project. And they can pick a project of their own choice that they would enjoy working on and learning. So essentially, it's just presenting yourself as a person who's flexible and willing to learn and contribute to make it a win-win. That's the only skill we are looking for.
And something that you guys might think about too, because whether you're graduate or undergrad, you guys have to work on projects. So the projects you pick, there's some great opportunity there to say, hey, we want to reach out to some organizations, build that network a little bit and say, I want to do a research study that relates to what you're doing. Would you be willing to work with me on that? And that's a generous offer to a team that might benefit from your knowledge and skill. I totally agree with Pawan. We love young, energetic, optimistic innovators who are risk takers. A lot of times after, let's say 25 years in the business world, maybe you've gotten really comfortable in your niche. So you get a little calcified. You don't try new things. You do a lot of rinse and repeat because it's known. But that's also how you become a little bit obsolete. So, having fresh talent and fresh eyes come in and look at something that maybe it's working, but it could be better, is really great for teams, for team leaders, for businesses, for organizations. But you could also take advantage of that when you're doing your research projects. So take something that's real world and turn it into a case study. And that's a reason to reach out to different business groups. And even, you could even say, hey, I want to ask my professor if my professor will help me to make this connection. Maybe you feel a little more comfortable having it as like a group effort to reach out. But you can totally take advantage of those projects that you're doing now, make them a little more practical, and think in terms of like, can I use this to build my own portfolio? Showing practical application, like Pawan said, that's a big deal. We can code switch your talents into a lot of different areas, bring in that energy and those ideas and mix it up a little bit. Challenge our own teams. Oh, that's super great. Have them try to think something different. But it's bringing in that mindset that like, I'm willing to try. I take feedback really well. That's very important, is to say I'm here to learn. I'm here to grow, and I'm willing to take feedback, and being receptive to that feedback, and also being willing to volunteer information, knowing that like it may not be the decision that gets chosen or the option that gets chosen, but it puts something on the table. So, feel confident enough to offer your ideas because you have knowledge and experience that is unique and different whenever you get into that working environment. And we love that. We love that kind of thing. And you guys, you have knowledge and experience. So, appreciate that and share it.
Thank you, Amanda and Pawan and Alan. We are out of time. So I want to ask you first, Amanda, the question originally was, can students contact you and can we share your contact information? And you say yes. Okay. So the one thing I want to ask before we leave, after thanking you profusely for being part of this panel, it's been really enlightening and encouraging to listen to you both today. I would like you both each to answer this question as succinctly as possible to encourage these students as they go about their day today. So my one last question is, what is one practical piece of advice you would give students as they leave this forum today?
Build a portfolio.
Build a portfolio.
Build a
Okay.
portfolio, and that portfolio should be accessible online. A resume, not enough. That's a bunch of words. Build your portfolio, and it has to be something that you can click on and see, have it represent what you can do versus what you are doing.
Okay, thank you. That's great advice. Pawan, what about you?
I would recommend focus on learning and understanding your stakeholders, which is part of portfolio building.
Okay, thank you both so much for joining us today and being a part of this panel. I myself have really enjoyed listening to your advice and your stories. I'm feeling really encouraged for our students, and I hope our students are coming away today feeling like there's a lot more out there for them than they realized. Alan, thank you for collaborating with the questions. And at this point, we'll sign off. And thank you so much, both of you.
Thanks, guys. Be safe out there. Have a great weekend. Enjoy your summer while you can. And give your professors a little bit of a slack. They're still learning the digital domain. So if they're working for you doing hybrid courses this fall, cut them a little bit of slack.
Thank you.